Hi, I'm Brittany Long, and I'm an RN currently enrolled in Lamar University. My aggregate community is in Harris County in Katy, Texas. The aggregate is made up of a low-income Hispanic women with diabetes, and today I will be helping you develop and execute a plan in case of a disaster strikes. When you have complications like diabetes, low income, a language deficit, and no transportation of your own, it needs to be input prior to a disaster for survival. A disaster can happen at any time, anywhere. This can include fires, hurricanes, tornadoes, flooding, and many other items that would cause a major disruption in our daily lives. When we have a medical condition like diabetes, not being prepared can cause major medical complications. These complications can include hypoglycemia, hyperglycemia, diabetic ketoacidosis, kidney failure, and the worst, death. The best thing to do is construct your disaster preparedness plan ahead of time. Throughout this presentation, I will describe everything you need to know to become successful in a proper execution during an emergency, and be discussing the supplies you will need, how to prepare medications, and who you need to call for help, and how to take care of your own wounds. First things first, let's see how much we know off the top of our heads regarding emergency situations. Which one of these items is not considered a type of emergency situation? A. Flash flood. B. Tornado watch. C. 50% off sale at Macy's. Or D. Hurricane. The answer is C. 50% off sale at Macy's. Yes, A, B, and D are all emergency situations that we need to be prepared for. If you pick C, you need to stop watching commercials and watch the news. In case of an emergency evacuation, where would you go if your area is in danger? A. The next door neighbors. B. Wander around till you find somewhere to stay. C. The airport. Or D. Speak with a friend, relative, or motel a distance away from the dangerous area prior to an emergency. Or, if not, call 211. D is the correct answer. Speak with a friend, relative, motel a distance away from the dangerous area prior to emergency, or call 211. Your neighbors will be evacuated too. The worst idea is to wander around aimlessly. There will be many others doing that, so be the smart one and be prepared. The airport in your area will be closed. How many days should you prepare your evacuation kit? A. 1 day. B. 30 days. C. 3 days. Or D. 6 months. Answer is C. 3 days. 3 days is what the CDC recommends for preparation of your evacuation kit. How long should it take you for you to evacuate your house in case of an emergency? A. 1 hour. B. 2 minutes. C. 24 hours. Or D. 3 hours. The answer is B. 2 minutes. The American Red Cross recommends every family member to practice escaping a disaster in 2 minutes or less. I have prepared 3 learning objectives that I would like my community aggregate to achieve prior, during, and after a disaster has happened. The first objective will be what to do before the disaster and how to prepare. The second objective would be what to do during the disaster in case of a diabetic emergency. And third, what to do after the disaster in case of an injury or a wound happens. First objective, what to do prior to a disaster. The community will develop a plan and prepare the necessities before a disaster occurs. This will allow the members of the community to prevent injuries or illness. The community will be assessed on the knowledge they already know regarding disaster preparedness. The nurse will be able to use the information gathered during the initial assessment of the community to revise interventions to the community. After analyzing the needs of the community will be able to be organized and build their individualized disaster plans. This is a list I will provide of the daily living supplies that the CDC recommends that everyone should have during a disaster. For a diabetic, you will need the supplies and medications necessary. A list of all your medications, written instructions for all your medications, have a 1-week supply in your emergency kit at all times, and make sure to rotate them out before they expire. Have a small cooler or insulated lunchbox to store refrigerated medications like insulin. Have all necessary supplies, syringes, needles, pen needles, alcohol swabs, glucometers, test strips, and lancets as needed. Transportation and knowing where to go is very important. If you have your own vehicle, make sure to always have a full tank of gas and a spare tire ready. If you do not have your own vehicle, there are hotlines that you can call and set up prior to an emergency. You can dial 211 and this system will set you up for emergency preparedness and will be activated during a situation of emergency evacuation. These programs do speak English and Spanish and can guide you and help you along the way. The Salvation Army Greater Houston Area Command is one example of a small local disaster location that my community aggregate can be located to. Objective 2. During the disaster, the family will be prepared to handle diabetic medications or complications during an emergency situation. The family will be able to assess the diabetic signs and symptoms of hypoglycemia or hyperglycemia and be able to perform the necessary interventions for hypoglycemia or hypoglycemia symptoms. The family member will be familiar with the steps and medications to prevent kidney failure or diabetic ketoacidosis. They will show compliance by demonstrating the signs and symptoms to look for and by demonstrating how to use the medications. This will be a handout provided to show everyone signs and symptoms of hypoglycemia or low blood sugar. This handout will have a list of symptoms, also showing pictures that could guide them to what the person looks like that is having a hypoglycemic attack. I will provide the members with a what to do step-by-step sheet that provides them information with someone having a hypoglycemia attack. This is a handout that I will be giving for signs and symptoms of hyperglycemia or high blood sugar. This presents a list for them to look at and also pictures to compare the person on what they could look like during a hyperglycemia attack. This will be a handout to guide the members on a step-by-step what to do with someone that is having a hyperglycemic attack. Objective 3. After the disaster. The community will be able to be prepared for after the disaster by knowing the proper techniques to evaluate the skin for any kinds of wounds obtained during the evacuation or cleanup after the disaster. The aggregate will understand the importance of why diabetic wound care is important. They will be able to demonstrate a proper skin assessment, wound care, and understand why it is important to follow up with their doctor. Why we check for wounds. Diabetes can cause healing of the wounds harder than a non-diabetic. These reasons can include nerve damage that can cause you not to be able to feel the wounds, a weakened immune system. When the body's natural defenses are down, even a minor wound may become infected. Or narrowing arteries. People with diabetes can have low blood flow that can prevent blood to get to the wound. The blood to the wound promotes healing. For a skin assessment, we perform a head-to-toe skin care. Begin with the feet and work your way to the top of your head. You wash and dry your skin and check for any cracked skin, cuts, scratches, wounds, blisters, redness, calluses, or any other changes. Note any changes to your skin at this time. Take care of any wound immediately. Any wound can become infected. Clean the wound and rinse the wound under running water to remove any dirt or debris. Don't use soap, peroxide, or iodine. This can cause further irritation. Use antibiotic ointment to help prevent infection and cover the wound with a bandage. See a doctor as soon as possible to prevent further skin damage. Now that we have learned a few objectives in how to prepare for a safety evacuation, let's find out how much knowledge we have retained with a few questions. How many days of medication does the CDC recommend for you to have in a disaster kit? A, 1 month, B, 7 days, C, 1 day, or D, 10 days? Answer B, 7 days. 7 days is long enough to be able to travel to a safe location for everything to calm down and get the person through the initial disaster period. When a person is unconscious due to hypoglycemia, it is safe to give them orange juice. True or false? False. Never give an unconscious person food or drinks. This can be inhaled into their lungs and cause shortness of breath, choking, and death. How often should you do a skin assessment? A, once a week, B, once a month, C, every hour, or D, once a day? Answer, once a day. It is important to maintain your skin integrity on a daily basis. I want to thank you for listening, and I hope you prepare yourself well for the disaster. We never know when disasters will strike, so just remember it is important to be ready at all times. Thank you again, and if any questions or need any further assistance, feel free to Google or look up your local Red Cross, Salvation Army, FEMA, or your 211 locations, and they can help guide you with any further information that you're needing. Thank you again, and have a great day, and good luck to you all. Bye-bye.